Spiritual Health at Emory Healthcare. We are accredited by the Association for Clinical Pastoral Education, which is really setting the standard for spiritual health education. It's a national, nationwide certification program. We are accredited by them, and they have outcomes and standards that we follow, and in our own ongoing learning process about becoming the best that we can be. We have several options for education. We have internships, we have residencies, and we have certified educator candidate training to become educators in ACPE. So usually the first level people apply is the internship. And we have folks who are usually in the midst of their training for their master's degree, whatever their equivalent is for their faith community, because we welcome people from all faith communities to apply and be engaged in our program. So you can apply while you're finishing your master's level education or beginning your master's level education for an internship. And you can do that either part-time or full-time, and we do have some evening programs as well and weekend programs, so that there's a variety of ways you can participate in that internship levels. So once you've completed your internship and then you've completed your master level of education, you can apply for our residency program, which is 3 units of CPE, Clinical Pastoral Education. So combined with your unit that you received during an internship, that will give you 4 units of CPE, which if you are interested in the path of board certification with the Association for Professional Chaplains, you can become, that's the amount of units you need to become on that path of certification, combined with your master's degree, your endorsement or ordination, depending on your faith group. So then we also have certified education candidate training, if you're interested in becoming certified as an educator at ACPE, which after you complete your residency is about additional 3 to 5 years of training. So one of the things to know about CPE, Clinical Pastoral Education, in our spiritual health program is that there are many different ways to use CPE. You can utilize CPE after you do your internship to really deepen your practice in spiritual health in whatever setting you would like to use that. If it's in your congregation, your temple, your mosque, is to be a specialist in spiritual health. You can go on to do the residency to then become certified as a chaplain in the Association of Professional Chaplains, or you can use that in the military chaplaincy, for corporate chaplaincy, hospice work, or hospital chaplaincy. But CPE is broader education than just for chaplains. It's for people who are just interested in deepening their spiritual health practice. The model we use in CPE is based on the action, reflection, action model. We believe in orienting people as best as we can to the clinical environment so that they can have success. But there's always this level of entering into the unknown when you're going into all the patient family rooms and this meeting with all the staff across the different units that each have their own culture. So you go out and you engage in this action of offering the best spiritual health that you can, and then you come back to into your educator and to your group that you work with, and you present cases, verbatims, about your work that you've done so that you can deepen your learning. In CPE, it's a different model because we want to present the work that we are struggling with, not the work that's our best polished practice. Because we really want to use the consultation process to see where our blind spots might be and how we can deepen our integration that we've learned from our master's level program. All the different concepts we learned, and then bringing that back into this setting, and also using a term from Association of Clinical Pastoral Education, CPE. One of our founders coined this term, living human document. We want to use your whole living human document as you engage the living human document of the patients and families and staff. So it has some vulnerability to the process, and we want you to engage learning how to handle more of your own suffering so that you can handle the suffering of others with more resilience and depth of skill, because it's about using your resources from your inner self as well as developing the outward skill. One of the things that makes our CPE program unique is that we've been here for a long time offering chaplain spiritual health services. So we are very trusted throughout our institutions at Emory, and we are very grateful for that. So we become very much a part of the interdisciplinary team, and we are looked for our insights. We also have a diversity of clinical sites across our Emory system, as well as a diversity of educators, educator voices. We are very privileged to have 8 educators on our faculty who all bring a diversity of style. So you may not get to work with each one, but they all inform the curriculum and they all participate in the didactics. We also value research, being part of a research-based institution. So we have a research literacy program, particularly for our residents. And we have a director of spiritual health research, Dr. Chuck Rezan, who's a really international leader in research and around meditation, spiritual health, and other subjects. We also are involved in a program of integrating cognitively based compassion training into our resident curriculum, and we are thrilled to be in partnership with the Center for Contemplative Science and Compassion-Based Ethics here at Emory around that, introducing that to our curriculum. So we really value the whole person, and we want folks to have all the skills that they need to be able to be prepared to be spiritual health leaders.